Hi friends, here today we will try to understand a very interesting topics of the psychiatry. For example, a person who is watching the television claims that newsreader is looking at him, smiling at him, giving messages to him by the eyes. And another case like a rickshaw puller believing that some celebrity is loving with him, gives him the missed calls, etc. etc. So, today we are going to start the psychiatry, some of the interesting topics and the examination in the psychiatry. In medicine, surgery, gynecology, dermatology, etc., we make diagnosis either by auscultation, inspection, palpation, percussion, etc. But so as to diagnose a psychiatric patient, we need to know the mental status examination. Number first comes the attitude. Attitude is how a patient behaves with the doctor. So we can say a patient can be cooperative, a patient can be dominating, threatening with doctor. This all tells the attitude of the client. Once in a while I was posted in the psychiatry, I happened to hear a client where he slapped the doctor. So in psychiatry, instead of speaking patient, we use a soft word, that is the client. Next comes the psychomotor activity. It is the activity level of the client. For example, when somebody is very happy, activity levels are increased, and when somebody is sad, activity levels are decreased. Next comes the examination of affect. Now, what is affect? Affect is nothing but is the mood state of client, and we all know that mood could be happy, the mood could be sad, and depending upon the circumstances of life, mood can be happy or sad. If we talk about some happy moment, our face reflects the happiness, and if we talk about the sad moment, our face reflects the sadness. The range of affect. In some psychiatric illnesses like schizophrenia, it is restricted. Means that when we talk about some happy or sad event, there is no face expression. There is nothing reflected on the face. And this is known as affective blunting, which is found in schizophrenia. Very common things that we see in the movie cinema is known as lability. That is, we have seen that somebody who's laughing loudly, ha 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 ha, it comes to tears, all of a sudden. Or someone who is very crying loudly starts laughing and loud, or some becomes very sad. In psychiatry, this is known as lability. So it is defined as sudden change of the mood state from one state to another. Now we discuss about the mania. We also discuss some historic personalities. Now, emotions are controlled by frontal lobe. In physiology, we must have told that emotions are dealt with the limbic system. The masters of emotion is the frontal lobe. Next we come to the examination of perception. Perception is what we all perceive from all our sensory organs: the touch, the smell, the hearing, the vision. There are the two predominant problems with the perception in the psychiatry are, number first one is illusion and the hallucination. Now let's try to understand what is illusion. Illusion is that, for example, If there is a rope and the client sees it as a snake, means that something is there, but client is seeing it differently. That means some stimulus is present, but it is misperceived by the client. This is the illusion. On the other hand, in hallucinations, perception is without any stimulus. If there is nothing, but patient sees anything, he is able to hear, it's called hallucinations. Patient sees it as clear, as vivid, and as three-dimensional as real. But if you tell the patient there is nothing, no man is standing here, he will not trust you as he can see it. So, patient will not trust you. So, in psychiatry, we call it as insight is absent. He is not able to appreciate that voices that are heard are false voices, no voluntary control. Client do not know when voices will be heard and when it will not be. So, it is not in the voluntary control of the client. So, there are the 5 important parameters to define a hallucination. Now, we try to learn the pseudo hallucinations or imaginary or fantasy. What is fantasy? Now, say someone has taken half bottle of alcohol and now he is hearing the voice of friend from Australia. Now, how is it possible? He himself knows that this is not possible. Now, he himself will think that he has probably taken large amount of alcohol. So here, the insight is present. Patient can say that he can hear the voices which may be in the subjective stage. He can appreciate that voices are due to the alcohol. We all imagine, we all fantasize, and we know whenever we imagine or fantasize, it is not clear, it is not in three-dimensional, it is in the subjective space. It is in voluntary control. Insight is present. So, hallucinations can be visual, auditory, as well as the olfactory. Visual hallucinations are related to the organic conditions. That is, some lesions, some hemorrhage, we do have a visual hallucination. So hallucinations are the characteristics of organicity is the visual hallucinations. Auditory are found in the psychiatric conditions and olfactory in the temporal lobe lesions. Now we are going to discuss some special hallucinations. Hypnogogic hallucinations. A person, when he is going to sleep and he is able to hear some voices in the ear, is known as hypnogogic hallucinations. When the person is waking up from the sleep and he is able to hear some hallucinations or he is able to see something, they are known as hypnopomic hallucinations. Extra-campine hallucinations. Extra-campine hallucination, that means outside the limit of the sensory apparatus. For example, like a person in the India is hearing the voice from the Australia without using the cell phone, etc., without using the internet. Now, person start thinking that God has given him the power so that he can hear any voices from any distance. Synesthesia is another name for reflex hallucinations. Patient says that I don't hear voices, but as soon as I see red color, I hear the voices. The moment I see the red color, I hear the voice. That is, here stimulus is one modality, that is, stimulus is in the eyes, causing the hallucinations in the another modality, hallucinations in the ear. So, stimulation in one modality causing the hallucination in another modality. It is commonly found in cannabis and LSD. After taking bhang and gaza, I hear the color and I see the music. Remember, I hear the color and see the music is a classical example of reflex hallucinations. Functional, I also don't hear voices, but as soon as bell rings in the temple, I hear the voices. Is that stimulus in the one modality and hallucination in the same modality? In our previous videos, we have explained about the autoscopy and negative autoscopy. Autoscopy is like viewing oneself without a mirror. For example, I myself able to see myself sitting without a mirror. In negative autoscopy, patient tells that whenever he goes in front of mirror, he is not able to see his image in the mirror. But other people are able to see. So patient is not able to see the mirror. Sorry, the image in the mirror. So in Indian mythology, there is a concept that ghosts don't have image in the mirror. So the patient starts thinking that he has become the ghost. It's a negative autoscopy. Now, complex hallucinations. When I see something, I hear the voices. And hear the voices. For example, it's shown in the movies. In Indian movie, there was a movie known as Lage Rao Munna Wife. There was a hallucinations of Mahatma Gandhi. So it's example of complex hallucinations. Now we come to the examination of thought. Flow of thought. Before we start on it, let us understand the normal thinking. The normal thinking is characterized by all except clarity. All includes consistency, continuity, organized. In psychiatry, the thought has to be consistent, continuous, organized, and may not be clear. Now, the flow of thought is very simple. How the thoughts are being delivered, and we all know somebody very happy, the thought flow is increased, and somebody is sad, the flow of thought is decreased. Now the formation of thought, that is the form of thought and the form of thoughts we have. The flight of ideas. In this, two thoughts are joined by the superficial association. It is found in Mania. Now you might be wondering what is superficial association. If you remember, when you were in the nursery class, you used to learn so many poems. Jack and Jill went up to the hill. Now Jack and Jill and hill, the last sounds are equal. And this is known as the superficial hallucinations. Now in this disorder, the person talks in such a way that he is saying a poem. It is very hot today. One must wear the white coat in the summer. There is a whitewash on the floor of the room. There is a white color in the national flag, and the Obama lives in the White House. Here the word white is coming many times, is used as superficial association. Prolaxity is the milder variety of the flight of ideas. The loosening of association, in this you will note that there is no connection between the two sentences. For example, Sri Lanka is in the south and India wins the World Cup match. Grass is green. So here you can see there are the three sentences. Three sentences are correct, but there is no association between the three sentences. But here one thing is very clear, that the client is able to make the sentences. When the client is not able to speak the sentences, he just speaks the word. For example, Dashrath, the Sri Lanka, the Rome, the grass. This is known as the word salad, or it is known as verbigeration. Remember, verbigeration is the another name of the word salad. Neologism. Neologism is the coining of new words or using the old words in a very unique way. For example, the patient is telling about the fan. Now he will say that it is a fan. He will not say that it's a fan. He will coin a new word for the fan. He will say that it is a dinchak. That patient, instead of using the word fan, he coined a new word. And this is most characteristic of schizophrenia. Now we will try to understand what is circumstantiality and what is tangentiality. These are the two very important things. In circumstantiality, here very unnecessary, tedious, boring details are conveyed before conveying the actual thoughts. For example, if some patient bought a shirt from the market, he will say that my mother has come from the America. I have a new friend. Mangoes are very juicy. I just went to the market and bought a shirt. Ultimately, the goal is achieved. He expressed the thought that he bought a shirt. But in tangentiality, that means the perpendicular. For example, if you ask someone about Diwali, patient will tell you one or more, two sentences about it, then he will talk something else. Diwali is celebrated in India. It is celebrated when the Lord Rama came back from Ayodhya. I also went to America, and for 15 to 20 minutes continuously speaking, he will speak unnecessary things and the goal is not achieved. Only one or two lines were told about it, but goal finally is not achieved. This is known as the tangentiality. Here, goal is not achieved, while in circumstantiality the goal is achieved. The possession of thoughts. There are many thoughts, and in this there is a thought block. Actually, there is a block in the thought. We all experience the thought block, but it is very transient thought block. That is when we are talking about something and we forget that what we were discussing. But when we are sitting in a group and some friends gives us a hint and we are able to recall that yes, we were talking about this issue. And once in a while we experience it. But in schizophrenia, it happens almost all the time. It seems as if someone is blocking the thought. Some block comes in the thought. And despite of giving any clue, they are not able to recall the thought. So, this is the thought block, and which we commonly see the thought block in our life. This is on the transient thought block. Thought insertion means that they are not my thought. Somebody is inserting the thought in my mind. Somebody is deliberately inserting the thoughts in the mind. Here the patient thinks like this. And Patient also thinks like somebody is snatching my thoughts. This is known as the thought withdrawal. If client starts saying that all people are talking about me, all people are coming to know my thoughts, whatever my thoughts, whole city comes to know. This is known as thought broadcasting. Now comes to the content of the thought. Now we will discuss about the delusion. It is fixed, firm, false belief, hold with undue conviction, not shared by others, or not matching with my socio-cultural background. For example, Eric Schapuller starts thinking he is going to the next PM of India. And it is a very hit news. People will think that he has gone mad. Roti khane ko nahi hai, and he is talking about the PM. Others don't think that he can, but he thinks that he can. Next things come the grandiose delusion. Big tasks are claimed in the grandiose delusion, like he's the power, God has given him the power, he has the friendship with the president of USA, claiming big and big things. The persecution, someone want to harm me, like people standing outside are making plans to kill me, people are laughing on me, they are smiling on me. There is a camera who is continuously monitoring my activity. This yellow color has been deliberately done so as to give me harm. So this comes in the persecution. A person watching television claims that the newsreader is looking at him or her, smiling at him, giving some messages to him by the eyes. Is a case of referral. Now comes to the Othello syndrome, the delusion of infidelity or the morbid jealousy. Somebody believes that partner is unfaithful. In old time, classically, Othello syndrome was described as alcoholism under the name of Greek called Othello. In the Capgras syndrome, it's a delusion of double or the duplicate. Client thinks that he's not my father, he's the duplicate of my father, he's not my brother, he's duplicate of my brother, he's, in Hindi word is Behrupia. Declaram bault, the delusion of lover. Erotomania. For example, Eric Schapuller, believing that Priyanka Chopra, a film star in India, is in love with him. She gives missed calls, messages to her. The Convad syndrome. It's very interesting. Here, the male partner thinks that he has got pregnant when her wife got pregnant. The delusion of being pregnant by the male partner when the female partner is pregnant is known as the Convad's syndrome. Thank you.